Okay, right. So the previous the previous topic was the result of percutaneous closure of VSD in Vietnam. So I would like to add, well, actually doing things the other way around, maybe Thailand and Vietnam instead. And this is my disclosure. And also I would like to address this talk mainly on the perimembranous VSD. Why? Because it's, VSD is quite common in Thailand, but the most common defect for VSD in Thailand, 70% will be the perimembranous VSD. I think it's likely to be the same kind of thing around the world. So I already mentioned that now we have a lot of devices available, and these are one of them which is available in Thailand and Vietnam at least. So how about result in Thailand? So we actually started, not we, but Dr. Krit, as you can notice him in the middle, Dr. Krit Vikram from Sirikit Hospital, he started the VSD program very early, since 2003, and that time he used the Amplacer PM VSD device and also the PFM coil in order to treat the VSD. And after that, in my center, with help from Dr. Thongphi Lee and also Dr. Hugh and Tin, so we start to use the device to close the VSD in 2009. And also, we have been honored for Thai people because Dr. Pontep, Let Sapcharan, he was the one who invented the cocoon VSD device. And as you can see, that for Thai patient, at least we have 3 kinds of devices available for closing VSD made in Thailand. And if you have a look on the geometry of my country, I'm here in the middle, about here, but there's a upper and northeast, and also the southern part, and also the eastern western part. So in total, we can close the VSD probably about 5 to 6 institutions around the countries. And how's the result? Well, the early result came from Dr. Krit's group from Sirikit Hospital. So because as I mentioned earlier that he mostly used PM-VSD device and the knit occlude VSD coil to close the defect. So he compared the result of the Amplacer PM-VSD device and the knit occlude VSD device. So including all the cases would be about 116 cases. And as you can see here, the success rate was about 94%. One patient in the PFM group had the AV block, and 5 had the heart block in the PM-VSD patient, which is contributing to about 6.5% in Amplacer group and 3% in AV block, of AV block in PFM group. And that patient actually transiently coming the AV block and then eventually disappeared. So if you go through the data between each group, and you're not surprised that VSD on the Amplacer group will be size will be bigger than the coil group, and that's because of the size of the device is matched more with the bigger defect by using the PM-VSD device. And likely also, I think similar to other part of the world, that that time, if you deal with PM-VSD, you're likely to use the Amplacer one. And if you deal with the outlet VSD, because it's softer and it's, as I said, it's applied very nicely and adjusts very nicely to the the aortic valve. So that's why the outlet VSD, knit occlude VSD device has been used more commonly. And when you have a look on the residual shunt, what he presented was after 6 months, just mild to small to moderate shunt, well, small shunt actually happened in PM-VSD group about 9%, while the knit occlude lay VSD is increasing a little bit in comparison to the PM-VSD group. Either is not statistical significant. AR actually a little bit higher on the VSD close by the coil, but that is in trivial to mild. And third degree reblock, I did mention already. So with that, well, he concluded that it's quite reasonable to use both devices. And when we have a look on the group of the patient with having high-grade heart block in Thailand, and it didn't show that we're oversizing it, and likely that it occur especially for the very first week after the procedure. But one patient developed heart block almost 1.5 years after he implanted the device. So it's quite scary actually for this patient which coming later on. And I think we know exactly that may be because of the radial force and compression force that increasing by the time, because it's quite stiff one, the PMVC device, and also it's expanding as time goes by, and that may injure the conduction system eventually. For the cocoon device, Dr. Pontep, including about 31 patients at the beginning, and that presented in CSI Frankfurt a few years back. So I was one of this group. So for the success rate, it's about 94%. But for a very beginning series of his collection, the hemolysis developed about 17%, but now it's getting better, and no evidence of heart block. So it looked quite promising also using this device, a part of this one that, eventually now I think the company tried to adjust that and make it more effective and less complication, especially on hemolysis. And also we just published the data from the two centers, from my center and also from Supar Center in the south of Thailand, showing that we had about 133 cases, and we had about 97% of the success rate, and maybe it's about new onset of the severe AR occur in 1.5%, and the new onset of the tricuspid regurgitation occur in about 0.7%. While the heart block, we had one patient. I'll show you later on. And the outcome, at 1 year, quite nicely showing that, for residual shunt, it doesn't seem to be an issue. About 10% had tiny to mild residual shunt, and trivial AR, we had 10%, sorry, about 10%. But in a trivial form and not progressing at the moment. So showing you that our data aged about 7 years, and the body weight is like that, and RV exit is about 4 millimeter, and the most of the cases was the aneurysmal type defect, but second most common would be the conical type. And this is a variety of the device that we use. Procedure time is about 1 hour plus, and fluoroscopy time is about less than 25 minutes mostly. Likely that we have a hospital stay less than 2 days. And here's the patient that we had a problem, major complication. As you can see, 2 of the patients had new onset severe AR. We need to ask the surgeon to bring to bring the patient back to the theater, take it out, the devices, and then that's device related definitely. This patient heart block also for 7 days after implantation, and we asked the surgeon to take the device back, take it out. That was 12 by 10 AD01 that time, and this patient new onset of severe TR. This patient actually we decided to leave the patient, and I'll just show you later on. But this is a patient with heart block. It looks quite big one, and a little bit of malalignment. You put the device in, and then day 4 post, the patient got complete heart block. So we asked the surgeon to take the device out and surgically correct the defect. TR, we had one patient with very severe TR, and you can see from the beginning having severe, and then 1 year post still having severe TR, and then even 4 year post still having the severe TR. So it means that once you are there, be careful. You may not be lucky to leave it away, even if you try to follow up and the patient is doing fine. For AR, as you can see that from the beginning, it looks as if it's just a bit higher than usual, but after you follow up, that AR severity is getting less in terms of the number and also in terms of the severity. So how about result in Vietnam? Thanks for Tin, he gave me probably a few years back, showing that about almost 600 cases that he involved starting from Syrian hospital himself, his center, to Jakarta, to Indonesia, Taiwan, Philippines, Malaysia, India. And what he showing was he had experienced only one patient with heart block completely using the unplugged muscular VSD device, and 3 hemolysis by using the PFM coil. And just recently, Dr. Hugh from Hanoi and his group, and also some doctors from Korea and India, recruiting the cases all together using the single disc device, the PDA device, to close the defect, VSD. So that showed that its number is about 300 cases, and success rates were about reaching 96%, and the follow-up time is quite long, because starting from like 2 years up until more than 108 months. So closure rate was approaching 99% after 2 years, with 2 patients having complete heart block, and device embolization in 3 patients, which is 1%. So that is the data showing that QPQS is quite high. Justified to close definitely is 2.1, and VSD size is about 4.8 millimeter, and variety of device, brand used, APCIS, Sarah from LifeTech, and Cocoon device, and most commonly used is a 6 millimeter device. And showing that already success rate and closure rate was reaching 97% at 1 year and 99% at 2 years. Complication, as I showed previously, heart block in 7 and 2 cases, which is 0.7%. So in conclusion, ladies and gentlemen, I would like to say that if you ask me about the result in Vietnam and in Thailand, I would say that procedural success was likely to be 93, 94%, up to 97%. If you deal with about heart block, well, it's reaching for the data that having the patient more than 100 cases, incidence is reaching starting from 0.2 up to 6.5%, but that is particularly related to the APCIS PMVSD device. And hemolysis depends on the device you use, but from our result, it showed that 2 devices as related to the hemolysis. Once you have AR, it's likely, if you start with a mild or trivial, it's likely that it will go away or getting better. But once you deal with the TR, if you start with severe, you need to be very careful. So thank you very much indeed.